Hi, I'm Dr. Roland Rotz. Welcome to my office. To make people feel comfortable, I don't wear a tie and sometimes I use humor. My specialty is in the arena of ADHD, attention deficit hyperactivity disorder. Most of the time, this is someone else bringing in someone with ADHD because they're seeing the concerns. It's often a parent of a child, or it may be a spouse bringing in their partner, trying to really understand what's going on, why they're not getting things done, doing what they promise. Oftentimes what we do is we sit down and do the diagnosis first, trying to get a better understanding of really what's going on. There are no two folks alike with any of these issues, and so frequently it involves kind of sorting out the various details and making sure that it is what it is. Once that's done, then we jump into the therapy of that. A lot of times, it really comes down to building what we would call a bag of tricks. We recognize that ADHD is this neurodevelopmental condition that just doesn't seem to go away. So in essence, what you have to do is develop strategies to deal with it every day. So that might include if you are someone who forgets to brush your teeth in the morning. You put the toothbrush with something else that you frequently do, like maybe have your cup of coffee. Well, you make sure that those things often exist side by side. So it's creating kind of reminder strategies. Another one is time management. Most of the time, folks with ADHD find that they are late to meetings. I forgot, I wasn't paying attention, or I misestimated the time. And so instead of, for example, instead of looking at what time will I arrive, we look at strategies like, okay, now you know what time you'll arrive, back that up until what time do you need to leave your house, estimating for maybe those multiple times back and forth to get into the car, traffic patterns, what time will you actually arrive, and can you arrive, too early? Possibly, because it might be boring to just sit there. So we look at how do you estimate that time. So that becomes a big part of it. And then a whole other piece of this practice, when we talk about diagnosing, sometimes it involves a lot of paper and pencil kinds of testing. And that often is me sitting down at a table over here and literally for about 6 hours. And usually that's broken up into 2 to 3 sessions. And I'm looking at, specific functions, cognitive skills, memory skills, how quickly one processes information. And all those things have a big impact on how one performs, like in school or work settings. Quite often, I will consult with physicians about medication effects. They have relatively little time with their clients, and so a lot of times I'm doing that and assisting, and kind of helping them identify, what are appropriate symptoms and what are side effects. There are some cases where I'm asked to just kind of consult and give some ideas. What's the possibility here? And that might involve 1 to 2 visits. But then when you look at, the ongoing and long-term treatment, a lot of times what I see is anywhere from, 3 to 4 months. Sometimes that involves, 12 to 16 sessions in terms of week-to-week kind of therapy. Frequently that week-to-week helps it, helps the continuity of it to just really, kind of build on one's skill base. In that context, then oftentimes I back off from that to every other week, then once a month, and then oftentimes it just goes to how effective I can consult with them if necessary. Frequently, in just about any of the work that I do, there's almost no diagnosis that exists in isolation. Exist in isolation means that ADHD, for example, is never alone. You grow up with this, even younger children. Oftentimes there's a co-occurring disorder. It could be perhaps a learning disability or a weakness in one, type of functioning of how one processes information. It could also be that, there are a lot of negative statements that are given to a child when they're young. It's like, will you be quiet? Will you sit down? Will you please? And kind of nonstop. So it's not uncommon that self-esteem becomes, damaged. And so we deal with the depression reactions. We deal with anxious reactions. I call them worrier warriors. People who worry themselves to death in order to get things done. And so it's all about really developing kind of an insight and awareness, but then beyond that, what do you do day in and day out? And kind of recognize that these are the mechanisms that can be life-changing.